Hello everyone. Today we will discuss about pericardial agenesis. So, pericardial agenesis is absence of pericardium. What is it? Absence of pericardium. It can be complete pericardium absence or partial, where only a portion of pericardium is absent. In complete pericardial agenesis, complete pericardium is absent. When only a small portion of pericardium is absent, then it is known as pericardial defect. Pericardial defect. So, what is the pathogenesis? Pericardial agenesis. It occurs due to premature atrophy of common cardinal vein. Premature atrophy of common cardinal vein. So, what is its clinical presentation or how the patient present to us? In most of the cases, it is asymptomatic and is detected incidentally. But in some cases, impairment of cardiac function may be present. Or patient may present with symptoms like chest pain, fatigue, or dyspnea. Now we will discuss about its radiographic features. On CT images, what we will see? So look, this is the CT image of a patient suffering from pericardial agenesis. Okay. So in patient with pericardial agenesis, we can see lung tissue in the aortopulmonary window. Look at this image. So normally in aortopulmonary window, see, this is aorta and this is main pulmonary artery. In normal patient, this space is filled with fat. Okay, this is AP window or aortopulmonary space. In normal patient, this space is filled with fat. But in the patient of pericardial agenesis, as you can see in the image, due to the absence of pericardium, in this space, lung tissue invaginate or lung tissue is present in this aortopulmonary space. Okay, this is the one thing. Another, so this is the next image, CT image of the patient suffering from pericardial agenesis. So look at this image. We can clearly see that heart underwent excessive levo position. That is shifted towards left. On X-ray images, there is one very important sign known as Snoopy sign. So what is Snoopy sign? It is present in X-ray of the patient suffering from pericardial agenesis. It is due to combination of levo position of heart, lengthening and flattening of border of left ventricle and left hemidiaphragm. In Snoopy sign, radiolucency separate the left lung border and left hemi diaphragm. So we will try to understand it with the help of a image. You look at this image, you can see on left side there is lucency between the left lung and left hemi diaphragm, and this is known as what? Our Snoopy sign. Okay, so what is the treatment? Patient who are asymptomatic requires no treatment, but the patient who are symptomatic can be benefited with pericardioplasty. So this was our today's topic, that is pericardial agenesis. We will do a quick revision. So pericardial agenesis is actually the absence of pericardium. It can be complete or partial. In partial, if only a small part of pericardium is absent, then it is termed as pericardial defect. So pathogenesis, it occurs due to premature atrophy of common cardinal vein. How the patient present to us? In most of the cases, it is asymptomatic, so detected incidentally. But in some cases, cardiac impairment may be present. So patient may present with symptoms like chest pain, fatigue, and dyspnea. What we see on CT images? On CT images, we see there is levo position of heart. That is, heart is shifted predominantly toward left side, as we can see in our image. And in aortopulmonary window, normally fat is present. When pericardium is there, in this aortopulmonary window, fat is present. But in pericardial agenesis, due to the absence of pericardium, lung tissue is present in this AP window or aortopulmonary space. You can see this CT image where lung tissue is seen invaginating in between aorta and main pulmonary artery. On X-ray, there is one very important sign known as Snoopy sign that will show levo position, lengthening and flattening of left ventricle and left hemidiaphragm, and a radiolucency separate the left lung border, inferior border of left lung, and the left hemipericardium. You can see this image. You can clearly see the left lung border is separated from hemidiaphragm with the help of a radiolucency. This is Snoopy sign. So how we treat? If the patient is asymptomatic, no treatment is required. But if the patient is symptomatic, pericardioplasty is done. Okay. Thanks for watching this video. Like and subscribe. Mini Medicos.